Hi, I'm Amanda Hall, and the population I chose to present on is physical activity among pregnant women. To begin, according to a report from the U.S. Census Bureau, there are approximately 76 million women of childbearing age in America. The U.S. Census Bureau defines childbearing age as a woman between the ages of 15 and 50. The report also asked if women had been pregnant within the last year and determined that approximately 4.1 million women experienced a birth in 2012. So women of childbearing age represent approximately 5.4% of the female population in the United States. The prevalence of overweight and obesity has been and continues to increase. In specific population groups, the comorbidities of this epidemic are more pronounced. Women of childbearing age are one group that is highly sensitive to this increasing epidemic. Here is some rationale for why this population is an important one to focus on in order to increase physical activity. The Institute of Medicine has stated that today, women are heavier prior to conception and are gaining more weight during pregnancy. This has serious implications not only on the health of the mother, but also on the health of her unborn child. Numerous chronic diseases are linked to overweight and obesity in both mother and child. Some negative consequences caused by overweight and obesity during pregnancy include gestational diabetes, pregnancy-induced hypertension, and an increase in the cesarean delivery rate. These conditions could be prevented through prenatal interventions. According to research published in the Journal of Women's Health, nearly 2/3 of reproductive aged women in the United States are currently overweight or obese. As the population ages, the rate of overweight and obesity will continue to rise. As the next generation, which demonstrated triple the childhood overweight rates than the current childbearing population, begins to have children, there will be triple the rate of overweight and obesity in the childbearing population. This is an alarming public health issue and will continue to have an impact on future generations of women wishing to conceive. Also, a higher proportion of women of childbearing age are overweight or obese compared to men, and women of younger or older ages, making this subgroup of the population, compared to other subgroups of the population, and the population as a whole, more susceptible to adverse health outcomes related to overweight and obesity. Overweight and obesity in women of childbearing age can cause infertility, gestational diabetes and preeclampsia, infants who are large for gestational age, cesarean sections, prolonged labor, and recently postpartum anemia. One surveillance tool that the Centers for Disease Control and Prevention utilizes to monitor this population is the Pregnancy Risk Assessment Monitoring System, or PRAMS. This is an ongoing population-based survey that is a joint project between the CDC and state health departments. There are currently 40 states that participate and distribute PRAMS questionnaires to pregnant women. It collects information on women's attitudes towards being pregnant and various experiences before, during, and after pregnancy. The CDC compiled data using PRAMS on 10 topics they described as winnable battles. One of these topics was nutrition, physical activity, and obesity. In 2009, they found that approximately 39.8% of women were engaging in physical activity 3 or more times per week before becoming pregnant. A study done by Donahue et al. Reported the same PRAMS finding, that less than 40% of women of reproductive age achieved the recommended amount of physical activity prior to pregnancy, and also added that over 25% of women are not active at all prior to being pregnant. Information from the U.S. Department of Health and Human Services reported that between 2009 and 2011, 16.6% of adult women met the recommendations for both adequate aerobic and muscle strengthening activity. Women are much less likely to meet recommended levels of muscle strengthening activity as compared to aerobic activity, and the U.S. Department of Health and Human Services found that about 20% of women met the recommended muscle strengthening activity levels versus 44% of women who met aerobic activity recommendations. This is a graph from the Women's Health USA 2013 website. It is produced by the U.S. Department of Health and Human Services, and the site states that Women's Health USA is an easy-to-use collection of current and historical data on some of the most pressing health challenges facing women, their families, and their communities. This visual demonstrates how many adult women are achieving adequate physical activity levels. It shows on the left the totals for all adult women, and then divides the population by educational attainment, demonstrating that women holding a college degree achieve the highest amount of activity in all the different activity categories, including adequate aerobic and strengthening activity, just adequate aerobic activity, or adequate muscle strengthening activity. In my findings of this population, I came across a paper by Johnston and Moreno. They wrote that pregnancy is a motivating life event that results in women becoming more health conscious and that they are more likely to engage in healthful behaviors. In their conclusion, they emphasize that during pregnancy into the postpartum period are ideal times to focus on obesity prevention for women and also extend that into the familial unit. During pregnancy, many women are focused on their growing baby, and pregnancy becomes an opportune time to motivate women to positively change their behavior. This can include eating a healthier diet and starting to become physically active. In 1985, the American College of Obstetricians and Gynecologists, or ACOG, published the first exercise guidelines for pregnant women. Prior to this, recommendations for physical activity during pregnancy were inconclusive and research findings were conflicting. Since 1985, ACOG has updated the guidelines in 1994, 2002, and reaffirmed the 2002 guidelines in 2009. The current guidelines state that a pregnant woman may engage in 30 minutes or more of moderate exercise a day, occurring on most, if not all, days of the week. These guidelines are applicable to all pregnant women, regardless of previous physical activity levels, and can be extrapolated to women in different BMI categories. Therefore, overweight or obese women can safely exercise during their pregnancy. Previously active women can maintain the same level of physical activity during their pregnancy. However, it is not recommended that women attempt to exercise to lose weight during pregnancy or significantly increase the intensity of their exercise during pregnancy. Gradual achievement of the ACOG recommendations for previously inactive women and maintenance of exercise for active women is key. Physical activity is a simple mechanism to control weight gain during pregnancy, and ACOG has stated the importance of physicians discussing physical activity with pregnant patients. In addition to controlling weight gain, physical activity decreases the risk of adverse pregnancy outcomes associated with overweight and obesity, such as gestational diabetes, preeclampsia, preterm birth, and excessive postpartum weight retention. Physical activity has also been shown to improve pain tolerance among pregnant women, improve their self-image, and results in less fat mass gain during pregnancy. One study found that physical activity during the year prior to becoming pregnant was a strong predictor of physical activity during pregnancy, and the benefits gained of physically active women continued into the postpartum period. From my personal experience working with this population, other benefits I've heard of include less lower back pain, improved sleep, improved mood and more energy during pregnancy, and lower rates of perinatal depression and postpartum depression. I didn't come across any studies that showed statistical significance for these benefits, but they're ones I've heard in the clinic. The types of exercise pregnant women can participate in includes aerobic exercise activities such as walking, hiking, jogging, or running, aerobic dance, swimming, cycling, rowing, cross-country skiing, and skating. Any of these activities for 30 minutes a day will fulfill the ACOG exercise recommendations. Additionally, like the guidelines for adults, 3 10-minute increments throughout the day is a feasible way for pregnant women to achieve a total of 30 minutes of activity. Pregnant women should avoid activities that have an increased risk of falling or activities that could result in contact to their abdomen. This includes contact sports such as volleyball, softball, or basketball, and activities such as downhill skiing, rock climbing, and horseback riding. Additionally, pregnant women in their second and third trimester should avoid exercises that require them to lie on their backs, since in this position the baby's weight can put excessive pressure on the inferior vena cava, the large vein that carries blood from the feet and legs, pelvis and abdomen back to the heart, reducing blood flow to the placenta, thus potentially depriving oxygen to the fetus. If a woman has any concerns about the types of activities she can participate in, she should always listen to her body or consult her physician if she has additional concerns. A common misperception regarding exercise during pregnancy is that previously inactive women cannot start a physical activity regimen due to their prior inactive lifestyle. However, as I mentioned earlier, a previously inactive woman can gradually begin to exercise and may progress towards achieving the recommended 30 minutes of exercise a day. Additionally, researchers have tried to determine why physical activity levels vary so much throughout pregnancy, and why some active women tend to drop off and discontinue physical activity during their last trimester. Some of the barriers I found include a lack of time for physical activity, feeling too tired, lack of access to exercise facilities, cost associated with physical activity, having other children and having a lack of childcare, and a fear of the safety of physical activity during pregnancy. Safety was an important factor, including safety or a fear of harming the fetus and fear of injury to the woman herself, due to a loss of balance resulting from being pregnant. I've also heard that nausea or other side effects of pregnancy associated with the first and second trimester deter some women from being active. Proposed interventions include utilizing the Community Guide's behavioral and social approaches, specifically an individually adapted health behavior change program. This type of an approach teaches behavioral skills to help participants incorporate physical activity into their daily routines in order to increase physical activity. The programs are tailored to each individual's specific interests, preferences, and readiness for change. These programs teach behavioral skills such as goal setting and self-monitoring of progress toward these goals, building social support for new behaviors, behavioral reinforcement through self-reward and positive self-talk, structured problem solving to maintain the behavior change, and prevention of relapse into sedentary behavior. An example of this on the research-tested intervention programs list is PACE. This program was based on the Stages of Change model and was designed to increase social support and self-efficacy, reduce perceived barriers to activity, and increase awareness of the benefits of activity. PACE, or Patient-Centered Assessment and Counseling for Exercise, required patients to complete an assessment while in the primary care provider's waiting room. Based on their score, the patient received a staged match protocol to partially complete before seeing their provider. During their physician visit, the patient and provider reviewed the protocol and discussed stage-relevant information during 3 to 5 minutes of counseling. The provider completed the recommended section of the protocol and provided the patient with a copy. 2 weeks later, patients received a brief booster call from a health professional. 84% of the participants in the study were female, and I believe a program like this could easily be adapted to pregnant patients who frequently visit their physician throughout their pregnancy. Other strategies that could be employed or interventions that exist include community walking groups and group fitness classes tailored for pregnant participants. Many communities offer prenatal yoga and prenatal water aerobics classes through community centers or private sports clubs or gyms. A community walking group could be implemented through such services like a women's church, her neighborhood, or other social community resources. For my capstone, I worked with the Women's Clinic of Northern Colorado to develop a healthy pregnancy curriculum and walking program for their patients. We're working to get a pilot program of this walking group started this spring, and I'm continuing to learn more about this population, its needs, and ways to promote physical activity and make physical activity more accessible to more women. If you have any questions, please feel free to ask me or refer to my references here for any of the articles or study I covered in this presentation. Thank you for your time, and I look forward to our discussion on Blackboard.